Good afternoon, everyone, and welcome to Reckoning to Rise with the Center for Economic Inclusion. I'm Tawana Black, the founder and CEO of the Center for Economic Inclusion, and I'm thrilled to greet you once again for our series this month for Black History Month, as we're diving deeper into the ways that we can all reckon together to build a more racially equitable and inclusive regional economy, racially equitable and inclusive workplaces, and places of belonging that help drive the indicators of an inclusive regional economy. I'm excited for another great discussion today with leaders in our community who are doing the hard work of building workplaces that exhibit those determinants of our health, equity, and inclusion. And I'm excited for each one of you who have joined us once again for this discussion. Today, as always, we are going to talk about both the strategies and solutions that are moving our workplaces and communities forward, but also the hard parts of this work, because no parts of it are completely easy. And we want to wrestle with the realness of this topic on today. And we're going to give you an opportunity to ask our panelists and these leaders questions about how we can begin to move our entire community forward. We would be remiss if we didn't acknowledge, particularly on today, while we are talking about health, equity, and wellness and inclusion, that our entire community is experiencing pain, heartache, and really wrestling with not only racism and destruction, but also the pain of loss, tremendous loss, as we suffered the loss of Amir Locke after police in Minneapolis killed Amir Locke, an innocent man, a man who did not need to be lost in our community. So just last week, and our entire community is wrestling with how we begin to uproot fear, uproot racism, uproot destruction in our communities that impacts all of us. How we begin to build communities, relationships, and put trust at the center of those relationships that can stop the senseless death and violence in our communities at the hands of those who are hired to be able to protect each one of us. Our communities are reckoning with pain in our neighborhoods, the safety of our communities, the safety of our children, the safety of workers and leaders and bus drivers and teachers who are hired to be able to protect and educate and transport our children. We are reckoning with how our children can be safe in the places where they are most expected to be safe, in their homes and in their schools. And we hope that today, as we have these conversations, as we build social capital and relationships together, that you find not only safe space, but brave space to be able to have not just conversations, but begin to take even deeper, more immediate actions together to build the type of community that all of our children, all of our families deserve. One that is not only safe, but one that is prosperous and thriving, where no one chooses the option to use violence to move our communities forward. Thank you for being here. Thank you for actively participating, not only in the work here today, but in the work in your places and spaces of work and communities and neighborhoods and schools every day. As always, we want to encourage you to build our communities economically. If you're having lunch today, if you haven't already chosen what you're going to have, I want to encourage you to take advantage of purchasing lunch from one of our BIPOC-owned businesses that you can find links to on our website. You see that on your screen today because we remind you of this frequently, that if we are not buying local, we'll be saying goodbye to many amazing local businesses and restaurants. And so please do take advantage of this list, not only today, but also as you're taking advantage and looking for caterers who can support your business and your organization at any point in time to help these businesses continue to drive economic growth in our communities. I also, as always, want to say a big thank you to our sponsors and investors who help the Center for Economic Inclusion bring this Reckoning series and our upcoming conference later this spring to you. These sponsors believe in the power of us as a community. They believe in the power of us convening and having workshops that help bring tools and education and resources, promising practices to you and to our promising community in order to build this economy that truly works for everyone. So we say a big thank you to each one of these foundations and corporations who continue to invest in our work here at the Center for Economic Inclusion. And for those that are businesses, we ask you to vote with your dollars, put those dollars in places and spaces that are aligning with our values and investing in our communities. Today, we want to, as we do each week and each time that we gather for Reckoning to Rise, do a bit of polling. We're going to do it a little bit different today in that we're not only going to poll here, but we're going to leave it open for a bit and then share the results a little bit later so we can have a bit more time. These polls, if it's your first time here, help us not only know who's in the room, but also know what your experiences are in participating in the Reckoning to Rise series. And we have a survey that will take place online. You'll get a prompt for that at the very end of today's session at 1 o'clock. And that survey is important so that we find out from you not only what your experience was and what you got from today's session, but also what you want to receive from the Center for Economic Inclusion in the future. So we encourage you, please take advantage of this poll and also be sure that you take the survey at the very end of today's conversation. And thank you so much for the feedback that you always provide to us. We truly do use that in order to inform the programming that we offer here at the center. And it means a lot to us to ensure that your voices are centered in the work that we do here at the center. I want to say a big thank you to our team, in addition to our sponsors. The entire team at the Center for Economic Inclusion, which is growing by the day, is always powering this work. You see me on the front of the screen, but there's a team of 22 people who are behind the scenes, who are doing work with employers all across the state of Minnesota and beyond every day in order to take the intel that you get here and drive it deeper into their organizations to help build policies and practices and decisions that help those employers build racially equitable and inclusive places of belonging, to help them build supply chains and talent chains and organizations that really embody the values of racial equity and inclusion, and help strengthen their bottom lines, to help government agencies really build their places of belonging and culture, help design economic development and workforce development, transportation and housing strategies that are helping to build places not only here in the Twin Cities, but all across the state and going beyond that. And I'm really grateful for this team and want to say a big thank you to them, let you know who's powering this work here at the center. We want to be sure that you're also taking this conversation in the room here today beyond the room. So take advantage of social media. You've got some hashtags and some tagging there you have on the screen here at Econ Inclusion. You can take advantage of having this conversation with us on Twitter, on Instagram, on Facebook, or LinkedIn. Be sure that you tag us, our speakers, so that we can continue this conversation beyond the hour. If you hear something that's amazing, share it out with someone else so that we can also be sure we're informing the masses. This conversation about health equity could not be more important at another time than it is today. And it impacts us all because every workplace needs to be sure that we're centering the wellness, both of our communities, but also of our very own talent. And that's the conversation that we're going to have today. So please do tag these speakers who are doing amazing work in their organizations as you continue to share this out in all of the platforms that you might be active on today. We want to take a time now to be able to share the results of our survey. Our team will do that, and you'll see those coming up on your screen. We see that we've got an increasingly diversifying base of folks who are here in the room, both in our racial makeup. Our age makeup has got some diversity here as well. We're grateful to see that. Love to see the mix there in our demographics inside the room here, and an interesting gender balance in the room today, a little bit different than we might normally see, which is awesome to see that balance. We'll see maybe not the 50-50 that we tend to see, or 50-50 and 10 that we might tend to see, but we've got our females who are outweighing everybody else in the room today. When we look at who is in the room in terms of participation, we see that we, again, have a lot of newcomers, which is excellent. Welcome to the center and to this Reckoning to Rise series. And it's great to see that we have so many who have participated in a number of Reckoning to Rise or Powering Inclusion sessions and are bringing that desire back into the space as well. And folks who are using what you've gained in a number of different ways from inside your convening spaces or starting to drive new policies in a number of different arenas. So thank you for all the ways that you're using this. And for those of you who are new, given that base, then we hope that you will begin to have answers that show us how you're using these tools, and that you'll gain something today that helps you go drive new, equitable, and inclusive health and wellness policies in your organization or with others across this platform as well. Thanks so much for those responses on tonight or today. Today's topic is one that is personal for our entire team at the Center for Economic Inclusion. And I'm sure because you're here, it's one that's personal for you as well. You might have seen this topic and thought, wait a minute, I thought the center did work in economics and racial equity. What's up with this focus on health equity and wellness? Or maybe you thought, well, it is Heart Health Month. Perhaps that is the focus, and maybe they're putting a spin on things. Both of those statements are true, but for us, it goes just a bit deeper than that. We know at the center just how much the factors of racial and economic equity have an impact on health and wellness. We know the stats and the factors, and we know that in our communities, those that we serve and work in, economic stability, neighborhood stability or instability in the physical environment, education, food and access to food, community safety and the social context, all play major impacts on healthcare and mortality, in addition to the quality of healthcare, the access to quality healthcare plays on our health and our mortality. We know the importance of focusing on those things that have been labeled as the social determinants of health, in addition to measuring and focusing on that quality healthcare and a diverse and inclusive healthcare experience, not just because we've been in and are continuing to be in a pandemic, but throughout our history. We've seen the impacts of these inequitable systems on giving favor to some and disadvantaging others. We've seen the impacts when we focus on addressing these social determinants of health, on improving not only the quality of healthcare, the access to healthcare, but improving people's lives, improving our outlook on life. Even though when we look at the pandemic, however, we see that even people who have some of the positives that we might attribute to those social determinants of health, ourselves who work inside our organization, when it comes to experiencing a pandemic, we see those disparities show up. From a personal standpoint, many of you know who've interacted with me over the last month and a half, I spent the majority of that time out of the office recovering from the impacts of COVID-19. As I shared my own experience and tried to keep family and friends across the Twin Cities and across the country, since my family isn't here, updated on how I was doing in the social sphere, I was amazed at the number of people who text and messaged me privately who were experiencing the same thing, but afraid to share it, afraid to say that they were 4 or 6 weeks out from having contracted COVID-19 and were still suffering, still seeking answers for why their breathing was labored, why their asthma was still flared, still seeking answers for how they could manage still going to work while really still performing health-wise at a labored rate, still not able to fully perform, still scared to tell even family and friends that this disease is impacting me at a greater rate than I see it impacting my peers, and I don't know what to do. I shared my experience pretty publicly because I knew that shame existed and that we needed to start to turn that. I also shared it because as a CEO, I recognize my privilege. I recognize the ability to take time away, to take a step back, and the need to be able to ensure that all workers are also operating in places and spaces where they have those opportunities to recover well, to heal well, to care for their families and be surrounded by people who are investing not only in their health, but also in their wellness, in their mental wellness when we go through struggles of physical unhealth, in health. We have an opportunity to start to change the narrative about this, and in particular, to add a layer to this where we consider racial equity and inequity and the role of employers in fostering more racial equity in our healthcare, in our wellness. And frankly, as employers, we need to be educated. We need to know more about what we can and should do and what resources exist in our communities to help us do better. Today, I'm thrilled to have a group of panelists here who are doing just that, who are leading in their own spheres in a number of different parts of our healthcare system and leading on the front lines of communities who have been invested in racial equity in healthcare for quite some time and are here to have a true and honest conversation with us about that. One of our panelists is on the front lines also of serving and addressing our injustices in our communities and had to step away for a moment for a press conference, and so will join us just a bit late. So please help me welcome now these panelists. I'm going to introduce each one of them as they come into the room. James Burroughs will join us in just a moment, but I'll introduce him now. James is the Chief Equity and Inclusion Officer for Children's Minnesota, where he supports the nation's 7th largest pediatric health system to advance equity and inclusion in all parts of the organization. James's key focus areas include patient quality initiatives, employee recruitment and retention strategies, and organizational culture. His work also focuses on increasing financial investment and spend with diverse businesses and supporting initiatives that address the social determinants of health for patients and families. Thomas Harris Jr. is the Executive Vice President of Operations and Chief Operating Officer for Gillette Children's Specialty Healthcare, With over 21 years of healthcare experience, Thomas is recognized as a highly skilled and results-driven leader with expertise in the areas of change management, performance improvement, and strategic planning. He is responsible for the patient care operations spanning hospital, clinic, ancillary, and integrated healthcare services for all Gillette sites, including virtual care. Vayong Moua leads advocacy for Blue Cross Blue Shield of Minnesota to advance racial equity and health equity across social determinants of health. His philosophy and action focus on integrating equity into governance across sectors and strengthening cultural communities for transformative change. He applies equity praxis into advocacy approaches and structural solutions. Moua championed Blue Cross's Health in All Policies investment and co-founded Minnesota's Complete Streets Coalition that led the passage of Minnesota's state Complete Streets law. And lastly, but certainly not least, Stella Whitney-West is Chief Executive Officer of NorthPoint Health and Wellness Center, a federally qualified health center serving 30,000 residents in North Minneapolis and Hennepin County. NorthPoint provides comprehensive medical, dental, behavioral health, pharmacy, laboratory, radiology, and human services, and has realized dramatic growth under this leadership of Stella Whitney-West in patients, revenue, and mission effectiveness. And we're thrilled to be able to welcome her and this entire panel into Reckoning to Rise. Thank you all so much for joining me on today for this very meaningful conversation. I want to start with a question for all of you and ask you to talk about what you have been experiencing, both personally, but also inside your organizations over the last 2 years, both from a perspective of how our communities have reckoned with justice and injustice on the streets of Minneapolis and St. Paul and across Minnesota, but also the weight that you carry as leaders who are committed to justice, who are leading inside your institutions and are known for leading inside our communities and addressing the racial trauma that we experience, both as a result of COVID-19, violence against Black, Indigenous, Latina and Latino and Asian bodies, and what that means for the health equity work that you lead. I'll start with you, Stella.
Thank you, Tawana, and thank you for this opportunity. I have to tell you that for me and my team, we have been dealing with a lot. So the same trauma that our patients experience, we are experiencing. In fact, I was a little bit shaken today because yesterday, and I'm sure many of you read it in the paper, there was a 15-year-old that was shot in North Minneapolis, and it was across the street from our food shelf. And so we had staff, we had volunteers, and we had clients that witnessed the shooting. And very, very unsettling, traumatic. And then shortly thereafter, there was a bus driver, school bus driver, who was shot and had children on the bus. That shooting occurred in front of the house of my administrative assistant. And so we deal with those same issues. One of the things, and I'll just admit it, I was an emotional mess this morning. And so met with my team. And so we talked about how are we going to, as a staff, as a team, how are we going to support each other? How are we going to support our patients and our clients who come in every day, who have to deal with the trauma? And even though we provide the support through our behavioral health staff, our medical team, but we've got to do more. So in addition to what we're able to do inside of our clinical walls, we are doing a lot of work out in the community, but also we understand that we've got to be even more active than we have been politically. And actually, as I told my team, I said, we have just we've got to get mad. We've got to, it can't be a nice conversation anymore. It cannot be. We are losing our young people. We are losing the safety that our children and our community should have. So we are trying. I spend a lot more time worrying about my staff in healthcare, and I know everyone else can say the same story. People are leaving. They're leaving the profession because of the stress. And so we are also challenged with how are we going to get the next wave of healthcare providers in the door. And so we're working on creating pathways, training that next generation ourselves, because we cannot afford to wait for them to walk in the door.
Absolutely appreciate that. And I'll let you all jump in as you would like to next.
So first and foremost, Tawana, thank you very much for pulling together this series. It has truly been a wonderful series and a blessing to me. I attended the last one, and so just the level of information that it's given through these series has been wonderful. But to go to your question, the weight has been heavy, honestly, and that's the best way that I can, express it. It has been heavy personally and then professionally. I will say on a personal basis, a little bit about my story. I've only been in the Twin Cities for 8 months. So I came to the Twin Cities on the heels of the George Floyd murder and then other shootings that happened here in the city. And so I had to take a long and hard look as to whether or not I wanted to take this position and come to the Twin Cities because of the injustices that have happened over time here in the Twin Cities. But I won't say I stumbled upon, but I interviewed with Gillette and was drawn in by the mission to, as we're talking about today, provide inclusive environments for our kids that have disabilities and then our adults also. And so I was drawn to the mission of this institution and felt like I could bring some experiences, some expertise, not only to the organization, but then also to Minnesota itself. And I felt that there were BIPOC employees at this institution and throughout Minnesota that needed to see me, and needed to see my face, and needed to feel my influence as an African-American leader in an institution and in a position such as this. As Stella pointed out, and as you pointed out, over the last 2 years, we as healthcare leaders have had to be innovative and had to be creative and have had to be courageous as we lead our workforce, not only through the pandemic, but also the injustices that have happened in the world. And so that's where we have to be authentic and be open and vulnerable enough to have conversations like this with our staff so that we can help them heal as well. And also have them to feel psychologically safe, that they can come to work and be their true authentic self. And have them to understand that we are here to support them, as well as their colleagues are here to support them. And so, those are the things that we've had to deal with, and some of the solutions that we put in place, like having open forums, having things like, I'm pretty sure some of the people on here know, one of our nurses here, Tammy Sinkfield, that started a forum called Salons, which is just an open dialogue for people to express their experiences with some injustices, and to also hear from others as to how they can help heal some of those experiences. And so those are the conversations that we have to continue to have. And the forums like we're having today are the forums where we continue to host so that we can forge our initiatives around health disparities and health equities and breaking down those racial barriers. We need to have these conversations and move these forward. And I am so grateful looking at the attendees today that there are less of us and more others on this forum. because we cannot solve this issue by ourselves. And so, we cannot have these conversations in a silo. It has to be inclusive of all. And so I am grateful to see that there's a mixture of people and genders on here, because together we are strong, and together I think that we can tackle some of these issues.
Well, I'll let James catch his breath. I know he's running back and forth between many monumental commitments. Thank you, Tawana, and thank you for concentrating us. I think it's these type of conversations that create accelerants for racial equity. And I think it's perhaps profoundly obvious to this audience, but the design of white supremacy is to separate our issues, our sectors, our communities. And so I appreciate the intentionality in which you've gathered us here today. To your question, Tawana, I would say Blue Cross is very much on a journey. We enter this space with a balance of humility and conviction. And candidly, I would say that our commitments to racial and health equity are still farther along than our capacity to live up to that, to operationalize that. We are in the midst of interrogating ourselves to figure out what is our role, both in terms of the contribution to structural racism and to advancing structural racial equity. We're still very much in the midst of figuring that out. But we also don't want to be stalled or be paralyzed by overanalysis. And I think we want to make sure there's a balance between changing systems, hearts, and minds. And I think none of us are going to be reliant on enlightenment alone. I think we recognize we've been waiting for 400 years and more. We've been waiting way before we even arrived on this continent, candidly. And so I don't think any of us are going to rely on changing hearts and minds alone in the near term. That said, we do have an explicit department called Racial and Health Equity. We are trying to engineer it into the way we function, the way we prioritize, the way we set our agenda, the way we utilize our political, human, and financial capital. So very much on a journey, but I want to just riff off of one of your earlier points, Tawana. I'm really glad that you referenced Amir Locke and the murder of George Floyd and how Minnesota is the epicenter of racial inequities. And I just want to draw a clear line behind the visceral, violent deaths in our streets, in our communities, to the slow, invisible deaths that are happening in pandemics and epidemics. And that the next forecast of the next pandemic for the United States, based on the American Public Health Association, is grief. And so I just want to make sure that we are mindful of that impact and that the interconnection between all of our work.
Well, Tawana, thanks for having me, and thanks for allowing me to be a little late to the party. Had to go give a town hall kickoff to people at Children's, and what I talked about was Amir Locke. What I talked about was the 15-year-old shot the other day, the bus driver shot the other day, Philando Castile, George Floyd, and Thomas made a great point. To your question, how we're doing, imagine me having to try to go recruit folks to come to Minnesota, come here and have a good time, come here and have this great prosperity. But we just killed another Black man in a downtown apartment complex that used to be called Symphony Place, that used to be corporate housing for a lot of different companies, including Dorsey and Whitney, when I used to work for, Target, and others as well. Imagine that, and imagine you're hearing that as a young person. Do you want to come to work in this town? Do you want to be a part of this fabric? If you do, you're coming with a conscious decision to change what's going on. And that's what we have to realize. We can't just sit idly by and not change anything and not do anything differently. I'm in a space too, because I reread the statement that my boss, our CEO, Dr. Gorlick, put out 2 years ago, that about 70 different companies jumped onto after the George Floyd murder. And it was about change. It was about doing things differently. It was about making sure that we don't end up here again like we have with Mr. Locke. The challenge I want to put out there, and this is a challenge for me too, is this is sometimes not about board diversity. This is sometimes not about C-suite diversity. this sometimes not about supplier diversity. Sometimes it's about what are you going to do differently to push the people in St. Paul to say, hey, no knock warrants, they're not working for people who look like me. Transparency in policing is not looking for people who want to make sure that bad officers are not transferred from department to department to department. Training is not working the way it is now. And company X, company Y, company Z, Children's of Minnesota, we got to lean in differently. We can't just be in the comfortable zone. And Stella talked about it. We got to be uncomfortable, do things that we would normally do. We might be focused on childhood policies. We also want to focus on public safety. We want to focus on engagement and other things as well. So I'm wound up. I'm ready to go, but I will say I'm hurting a lot with all the violence going on as well in our communities.
So I appreciate all of the statements that you've all shared. And I, of course, am feeling this personally too. And I am charged by James, the last statement that you shared, and how there's a responsibility for people who are in power, who have influence, to use that influence to start to change the way that some things happen in our communities, in our city, in our state. And I'm also struck by this conversation about health and wellness. And there was a time where we had topics about those things you just don't talk about in the workplace, those things that you leave at the door. But today we're in a place where we know better. We know that people don't leave what they experience at home, what they read about in the newspaper, but more than that, as Stella pointed out early, the things that you simply experience on your front door someday, the things that are right outside your front door, you don't leave that at the door when you log on to Zoom, or when you come into the clinic to work, or when you come into the call center to be able to work at Blue Cross Blue Shield. That stuff doesn't leave you. It stays on your conscience. It weighs on you. It takes away hours from your life, days off of your life. It takes off of our children's ability to go learn and to be effective in the classroom. How are you all wrestling with that? How are your workplaces managing, creating space where real people can show up? I think Thomas said this, where they can be themselves. You can be your real self, with all that that really means in the midst of so many pandemics, the pandemics of racism, the pandemics of injustice, and the pandemics of COVID-19 and heart disease, all these pandemics. How are you creating that? And for all these folks, to your point, who come to our Reckoning series to try to figure out how to make better workplaces where they are, what do you say?
So I would say that you have to be intentional about focusing on those things and actually putting actions to them. So one of the things that we've done recently, well, not probably within the last year or year and a half here at Gillette, is we have formed organizational resource groups. And those are wonderful forums for people who have kind of the same agenda and are bound by similar characteristics to come together and have an outlet at which they can express themselves, and then also work on initiatives that they feel that they have in common. And so I am the current executive sponsor for what we call our GBIRD ORG here, which is the organizational resource group for Black and Brown employees. And so, one of the things that we've done and we've kicked off for Black History Month is we are not only sending out information about African-American pioneers and BIPOC pioneers who have really pushed agendas forward to break down racial barriers and injustices and health disparities, but we also have forums in which we, again, can come together and bring our authentic and vulnerable selves to the table and have discussions that help to uplift and to inspire. One of the last sessions that we had probably about 2 weeks ago, one of our psychologists did a wonderful forum and series on code switching. And so even though it was more kind of racially based code switching, what we define in that session is that code switching can be centric to gender. It could be centric to sexual orientation. It's not just racial, but in this particular instance, we were talking about, the racial code switching. And again, it was a wonderful forum for people to learn what code switching was, to talk about their experiences, to educate others on why sometimes we feel the need, especially people who look like me, to code switch in their environment because it's a way of fitting in and being heralded as being more professional and things of that nature. But still, sometimes it warrants you not feeling like you are being authentic and truly who you are. And so creating forums, intentional forums like that is the way, to your question, that we get to starting to break down those barriers and actually being a more inclusive environment.
Thank you. I'd love others realizing each one of your workplaces are a little bit different. Stella, I'm drawn to NorthPoint, recognizing you've got different types of facilities in different spaces and places as well. What's it like in your organization right now?
Well, we are trying to heal, but one of the things that that we started 2 years ago with the onset of COVID-19 and what it meant for us as a health and social service organization, we started weekly huddles because a lot of our staff were working from home, and we still had staff that were here working in the clinics, staff that were working in the schools, because we're also in 6 different public schools in Minneapolis. And so we found that the huddle, and we do it every Monday, we start off with a mindfulness exercise. And it helps to center us. It helps, and actually for people who did not practice mindfulness, and I'm one of them, I started to pick up the tools about, when you feel yourself being stressed, how do you find that kind of quiet and breathing? And it doesn't take a lot of time, but understanding and being able to know when you need to do it. And sometimes I can do it in a meeting when I know, and I'm about to explode and I'm about to say something. Okay, right? I say, right? But sometimes, and you do it to center yourself, but you still say what needs to be said. So we've done that. And then also we have an employee engagement committee that also works, and they bring different ideas on how we can best meet the needs of the staff. We are also connected to Hennepin County, and so there are a number of employee resource groups as well. And just recently, there's a group for the African American staff, and I've participated in that group and have done panels as well. But I do think that you do have to create the space where your staff can be authentic, and I think it's important that staff know that you, as a leader, that you can be emotional. I mean, my staff have seen me cry. They've seen me at a point where I'll just say, I need your help, and we work together. I think that one of the things that we have to create, and we're doing that now with our campus expansion, is physical space. So we're creating a larger space for our staff. We're creating also meditation rooms where they can go in and just have a room where they can have that quietness, where they can meditate, they can pray, because you don't know what they are experiencing, maybe something at home or in the community, or just an interaction that they had with a patient. Many of our staff, oftentimes when there is a tragedy in the community, oftentimes they are one of our patients. And so we try to make sure that the staff who have worked with that patient and that family have the opportunity to be able to deal with their own emotions as well. And that we as a staff are able to support them. And that's one of the ways that we can take care of ourselves so that we can continue to provide the healing and support that we need to in the community. I think, and it was good to hear that. I think that was Thomas that said that. I forgot who said that the next epidemic was going to be around grief. It is. It is. This is not COVID-19. And thank you, Tawana, for sharing your story, because there's been a change around COVID that has exposed something that we all knew was there, but exposed the political, around healthcare. I mean, those of us are in it, we already know that if you're going to get something done, you got to go right to the policymakers, and the business. Healthcare is a business, right? So it makes a lot of sense that it is this forum is being put on around the economic inclusion. And we also have to understand that if we're going to make changes, we got to make changes and we got to have impact on those levels. But we're going to be going through the impact from COVID-19, the grief and the loss is going to be ongoing for a number of years.
You know, just recognizing time, I'll be really brief here, Tawana. I think beyond the fundamentals of what Thomas and Stella shared around creating space for healing and connection, I think there's a real craving for shifting power dynamics within organizations, getting involved with governance, changing decision-making. And that certainly has an internal implication, but it also has an external one. And I think Stella alluded to it spot on, that we need to prioritize civic engagement as a political determinant of health. And I don't mean political in like partisan, but I mean political in sense of understanding how power, resources, privilege impact decisions, right? And so I think the more we can shape and draw upon the agency of our employees inside out is what is really supporting both the healing and the impact of our employees.
Absolutely. I really appreciate that. I am noting the chat here. Each one of the comments that are coming on, both of people who certainly are agreeing with you, but also are elevating the impact of the pandemic. And so many of us are working from home. We've seen this in our own organization at the center, things that you can take for granted. I appreciate you, Stella, and your vulnerability in sharing the seat that you sit in as CEO. It requires also the vulnerability and authenticity of the team supporting you as well. But then knowing where's my team at? How are they? Each one of us are experiencing things. Sometimes we know them, but we don't know nearly as much as we knew when we were all in one building every day, and you could see people's faces and know, wait a minute, you're not all right. What's going on? How can I check in with you? We don't know as much right now. How are you all managing that? How have you adapted any practices, any policies, any benefits, any new tools, any resources to manage employee wellness and healthcare in this time where we don't all get to see each other? And how are you equipping supervisors and leaders to be able to do the same and build team and culture in this space in ways that also support wellness, particularly in light of everything that you've shared already? James, I may start with you and come back around.
Sure, I'll begin. First, we got to acknowledge that it's hard. We keep pretending like, oh, you work remotely, your manager's here, you can do it. It's easier to do. No, it's hard because you can't tell the gauge of how your employees are doing by looking at them in a square and talking to them for 5 minutes and say, hey, I'm doing great. You may not be, but that's that vibe you feel when you're at the office. The other thing I'll say is what we're trying to do more of is engage them in meetings that aren't about the work, but about who you are and what you're about. What are you going through? And kind of build a relationship. Now, it's harder on a video screen to do that. What I'll try to do is limit it to maybe one or two people or maybe one-on-ones, not about work at all, but about how you engage it. If your kids are at home for the week because the pandemic has hit your school, or your daughter caught COVID like mine did in December, she out 14 days and looking at her mom and mom looking at me like, okay, who's gonna do what? How we do this again? And then she's running around like, how are you dealing with that? How is that impacting you? The other part of it is too, realizing that equity and inclusion is in a hard time now, not because of racial injustice, because if I can't physically see you, touch you, feel you, and be in partnership with you, it's harder to know what's really going on. I can't really, when I used to teach training classes or development classes in diversity, you're in a room, you know what's going on. You feel the vibe, you feel that tension. You're on the screen, you can hide from me. You can hide from me by clicking off your video, and you can hide from me by just sitting there smiling, like, yep, yep. And over there playing on your phone, like, well, when is this over? And those kind of things are tough to do. The other thing I'll say lastly is what we try to do too is give people more breaks. I don't really pay attention to say, okay, if you're at work from 8 to 5, got it. As long as you get your work done, I don't need to know where you are from 9 to 9:50. I don't need to know that you're in the office or you're around. Whatever you need to do to make yourself healthy and well and get the work done, do that. And also, I'm allowing for a lot more, I won't say failure, but a lot more pushing back of time. If you can't get it done because you have life happening, I'm going to let life happen, and I'm going to be there to support you in life. I've had too many friends die, had heart attacks, caught COVID, parents that are deceased now, parents that are they're taken care of. We got to factor that into leading now. We didn't before. I personally didn't before. I was like, oh, let's go get it. We're going to do it. That's it. But now I'm more cautious about the whole person, that full self. If you bring your full self to work and I ignore it, that's on me. I can't ignore that full self if I ask you to bring it to work. So we're trying to do more of those kind of things as well.
Others?
So I'll jump in. Similar to James, I do agree that it's difficult. But one of the things that we have been again, I use the word intentional about doing is doing rounding. And just like James stated, the rounds are not so much about the business. The business does come out, but it's more about bridging that connection and trying to, understand where people are and asking them what's working, what's not working, what barriers are you running into, how are you doing, how's your family doing? Really getting to that kind of more interpersonal and humanistic side of people rather than just the professional side. And then through some of these conversations, literally employees have told me, I really don't like working from home because I feel separated, and I feel like there are times where I go through depression and I, would like to come back to the office. And then there are other people that said, hey, I'm wonderful. I love working from home. This, meets my needs and I want to continue to do it. But if we had not put these forms in place for them to feel, I guess, having the autonomy and having the empowerment to address these issues and answer these questions authentically, then we would have never known and figured out that information. The other thing that I'm pretty sure everyone probably does is we have an employee assistance program that is free for employees. So if they are having issues coping with just the world today, they have a resource that they can tap into that's provided to them free of charge, where they can talk to someone and get some help and get some assistance with dealing with whatever issues they're running into. And so again, those are the things that I think that all of us have to do in order to make sure that for our workforce that is truly working remote, that we keep them engaged and we keep them supported.
I know we're out of time, Tawana, so I would just say, regardless of the mediums in which we connect, whether it's virtually or in person or whatever the tools are. I mean, I think we're all trying to make sure there are multiple entryways to having meaningful conversations. I think the crux of it is to make sure that the relationship is in depth and authentic, and that we're not reliant on just the channel, but that, when we connect is why are we connecting, and how do I connect with you on multiple levels? I'll just leave it at that.
Absolutely. I really appreciate that focus on authenticity. And Stella, I know you're going to share something. I'm going to add a question that I think is coming to you from your statements earlier around mindfulness. And if you can share some more examples about what that looks like to really bring mindfulness practices into the workplace that help to drive wellness as you share additional comments.
So I will say that mindfulness practice we do as part of our huddle, and it is virtual, because we have staff both working on site and at home. And one of the things that it becomes a way that staff are brought together, not only through the mindfulness exercise, but we also provide COVID updates and things of that nature. But I always watch the chat because staff are communicating and engaging with each other through the chat. And they may be talking about, and it can be something really simple that is somebody's birthday. And then you'll see, and they're using emojis and they're talking and they're clapping and they're, all of those kinds of things that they normally would be doing if they were working in person, they're able to do on the chat. And oftentimes they'll post like silly videos and things like that. And so and again, our huddle is 30 minutes, yet it's the most powerful 30 minutes because we're able to connect. The other thing that I will say that as a leader, what I've learned to do is not react and to be open to recommendations or suggestions that staff have. And so I'll give you this one example with the murder of George Floyd. We all know how heavy that was on all of us. And so the staff came and they said, we want to do a protest. We want to march. And I'm thinking, okay, how are we, we're not going to close up the clinic and go march. So what we did, staff organized it, and we had drummers, and we did signs to show what we were feeling, and we marched around the block in North Minneapolis. And as we were marching, people were honking their horns, they were waving, and it was therapeutic for us as a staff because we felt like we were doing something, we were able to say something, and we were able to do it together. And so I say that for leaders to be open to when your staff come to you and say, this is what we want to do, and trust them.
I absolutely love that because we found that even within our own organization, the ideas that one person has often catch fire and may not be the first thing that you might think of as a leader, or might be, but you don't know till you open up that space for individuals to share what they're interested in. I know there's a question that just came in. We've got just like 2 minutes left. It's about public policy, and Governor Walz is certainly investing in racial equity and health. And specifically, this question raises his investments in Black maternity death rate and asks, are there legislative goals that you all have in terms of gaining equity in health? And what are they? And do you all hope to work as a collective? Are there any legislative policy goals that you all have that you want to be sure the audience knows about in our final moments?
So there are two
I would just say
for sure. So I would say definitely maternal and child health for sure. And then mental health, the expansion of mental health. As I mentioned, we're, and particularly in the schools, bringing that to the schools where you can reach children where they are at. You can help the teachers, the staff, and also the families, expanding school-based healthcare services.
Absolutely. Vayong?
Yeah, I would just say that the highest goal is to embed racial equity into policy making itself, okay, and across issues, across the way decisions are made. And this session, I would point you to pay attention to the racial equity impact note. I know, Tawana, I'm working closely with your team on making sure that racial equity impacts are embedded in the generation of fiscal notes. So we're not only quantifying the costs of legislation, but we're looking at the racial equity impacts.
Absolutely. Thank you.
And ours will be maternal health and mental health. We're going to put 22 inpatient beds in St. Paul Hospital, our facility there, and invest about $20 million in expanding mental health for young people. It's had a tremendous hit with COVID and other things as well. So we're invested in that and look at legislation change that. And also maternal health as it relates to Black maternal health is poor now. And it's because of what we're not doing as healthcare systems. We always talk about the social determinants of health, what happens outside the hospital. Well, part of that we're responsible for. And we got to change that to that racial equity and policy lens as well. So, and the last thing is we're creating a collective for community health, which is going to create more community partnerships where we're co-creating design around health together. That before we were doing it unilaterally, we're going to do it together with community.
Awesome. Thomas?
And so for those of you who, some of you know and some of you don't know, that Gillette Children's is a specialty hospital that really focuses on treating kids that have complex, rare conditions and traumatic conditions. And so kind of in layman's term, it's things that affect the brain, the bone, and the movement. And so we are really passionate about making sure that our kids are included, and we're creating an inclusive environment for them. And so one of the things and bills that we're working on with a couple of other corporations and entities throughout Minnesota is creating more inclusive playgrounds. So this group is working with multiple cities across Minnesota to submit bonding requests for funding to build these inclusive playgrounds. And it's so important because for our kids that have developmental disabilities and intellectual disabilities, you want to make sure that these playgrounds have appropriate fencing and that there are no water hazards there and things of that nature. And so, you know, the way to support us is to reach out to your representatives to make sure that you levy and cite your support of these legislations.
Absolutely. I am thrilled to hear that each one of you are advancing public policy in addition to the phenomenal work that you're doing inside your organizations to provide not only radically inclusive healthcare, but also great services to your own employees. Thank you so much for joining us, each one of you, but more than that, thank you for being great partners to us at the Center for Economic Inclusion. I want to say a big thank you to our audience for joining us today, for your questions, for your engagement. Our policy agenda, our team shared with you in the chat. As was mentioned, we're not only advancing the racial equity impact notes and that focus on making sure racial equity is embedded in all public policy, but also focused on inclusive economic job growth so that all people in Minnesota have equitable access to real wages, family sustaining wages, and an opportunity to prosper. I want to remind you as we wrap up, to be sure that you stay in order to get that link to the survey and give us your feedback, to be able to use the tools and ideas that you received from our speakers on today. I want to encourage you to register for our last workshop of this month. Next week, we're going to talk about women in the workplace and money. That's a topic we all need to be engaged in, and you won't want to miss our author, someone who used to live here and is coming back, Dr. Candace Stillflippen, who will join us for an amazing session. So please be sure that you join us, as well as two amazing panelists, and be sure that you also join us and take advantage of these resources from Comcast Rise, where Comcast is investing in businesses in our community, and in particular focused on women-owned businesses like us in our announcement last week with our new focus on Project Vanguard for Black and Latino women-owned businesses. So please take advantage of that. And lastly, corporations and businesses in our community, you have an unprecedented opportunity to measure your impact by using the Racial Equity Dividends Index, the first ever index in our marketplace that is going to help you be able to measure whether or not you're making forward progress on the leading standards of racial equity, inclusion, and belonging inside your business. Our team is ready and waiting to be able to get you registered for that index so you can get not only a report about your own business, but also an understanding of how you're doing alongside your peers in Minnesota. Please register for that. You can see information on our website at centerforeconomicinclusion.org. And we thank you for joining us today and encourage you to stay to take the survey. Thank you so much.